So my name's Sonia Srinivasan. I'm a GP and I'm on the board of directors for GP Registrars Australia, which is an organisation that works very hard for you and advocates for you and your rights and your interests. And so I look forward to telling you more about what we're going to do alongside your training. Just to start off, I'd like to acknowledge the traditional custodians of the land where I am. So that's the Wurundjeri Woiwurrung people. And pay my respects to their elders, past and present. I think it's really valuable to, as we're entering into GP training, or you are, and as I continue my clinical work, we reflect on just the tens of thousands of years of accumulated knowledge and wisdom that comes along with the oldest continuous living culture on the planet. And keep that in mind as we're invited into people's lives every day in our work as GPs. So today we're going to be covering an overview of who we are as an organisation. So we're a national independent impartial advisor for future GPs, and I'll explain what that means. Welcome you to GP training, which is really exciting. It's a really wonderful transition. So yeah, I guess take what you will from this presentation then. I think there are elements that are really, useful for all elements of training. And GPRA, of course, represents regardless of your training pathway. So ACRM, RACGP, RVTS, Rural Generalist, wherever you're going. Although it sort of says GP registrars, we tend to cover all people who are in their stages of training to become a GP or an RG. So we'll talk about the general practice placements process, employment conditions, and then opportunity to ask any questions. I'm on the board of the organisation. I don't work for GPRA, so I'll answer my questions as best I can, not being a registrar advisor. If I can't answer your question, I will direct you to someone who can, or you're always welcome to email inquiries at GPRA. So I'll just introduce myself a little bit. I am a fellow GP. I fellowed 2.5 years ago. I did my internship at Western Health and a couple of resident years, and then I did my 4 training terms across sort of inner Melbourne, mixed but mostly private billing practice was one of them. Then I did 2 outer suburban placements, community-based health bulk billing, one of which was a lot of refugee health. Um, I did extended skills in the academic post. So that meant that in my last year, over 12 months, I did 2.5 days in general practice and 2.5 days at Monash University, teaching medical students and doing research. And I really encourage people, if you're early in your training and the opportunity is available, to really look into an extended skills post. It's such a great opportunity to really get additional specific skills that I think are becoming really more valued and in demand as we go forward with GP. So now I work 3 days a week at the clinic I started at in GPT-1. I also have continued some research work on the side. I do some leave cover at a women's health hub clinic at Western Health, the hospital. Occasionally leave cover, and then I'm also a parent, so I get to spend 2 days at home with my daughter. So this is kind of what they talk about when they talk about portfolio careers. Like you're able to, once you fellow, you can really build the parts of work that you like and kind of create a career from there. So that's a really exciting part of becoming a GP and quite different to hospital-based specialties. Something that's really valuable all throughout training is thinking about like what makes a good practice to work at. And so practice demographics, what that means to me really is a broad range of demographics that you're going to see. So it's not ideal if you're in a clinic where like you only see young professionals with few chronic conditions, but maybe high levels of stress and work-related mental health. It's not ideal if you get to your exams and you haven't managed type 2 diabetes or delirium in an older person, for example. So when we think about practice demographics and training, getting a really wide range of people you're going to see is really beneficial for your skills and also for your exams. Education and supervision. So things to consider about that. It's possibly self-explanatory, but things like, is your supervisor there every day? One that comes to mind for me was if your supervisor is a man. So I mostly had male supervisors. Are they comfortable, confident in women's health issues? Are they going to be able to help you with a speculum? Many will be, and some may direct you to another GP in the clinic. So that's really helpful to know. Practice culture is one of those things that's quite hard to assess before the fact, but you know it when you feel it. You know it when you're in it, and it's a good practice culture. But one thing that I have found myself is, are all the GPs booked for lunch together, or does everyone's lunch kind of stagger and everyone eats alone? Do people eat in their room or do people eat together in lunch? I think for me, that really changed the culture of my training. And certainly where I'm at now, we have an hour together for lunch every day. All the GPs eat together. That's probably a bit unusual, but it's a really lovely part of the culture. Practice workflow, to me, that sort of means how your day is organized. So, how you're booked in by reception. Something that was not ideal for me is when, I'd be booked for a 15-minute appointment with a patient, and then I'd be double booked to pop in for an immunization or pop in for a chronic condition management plan with the nurse. So, workflow is how your days run. Probably if it's working well, you don't even notice practice workflow, but there are a lot of things that reception, admin, nursing staff can do that make your day run a lot smoother and make you less stressed. Working hours, conditions, and remuneration. So these really relate to the NTCER, the terms and conditions, which if you're already on training, you're already in the clinic, you've got a contract, hopefully you know a bit about, but if not, we'll discuss it. So, who are GPRA as an organisation? So, the organisation's 25 years old, and really we are your support advisors and advocates for your rights and interests in training. Um, so, when we say we're the only impartial advisor, what that means is it doesn't matter what college you're a part of, it doesn't matter, whether you're part-time, full-time, where in the country you're training. You can come to GPRA for support and advice, and you can rely on GPRA for advocacy. So the ways we do that, the really important one that's relevant today is negotiating the national terms and conditions for the employment of registrars. We'll talk about that more in a second. We advocate at the policy level for issues impacting trainees in general practice. So the most exciting one recently has been securing paid parental leave for GP trainees at the end of 2025 after years of lobbying by GPRA. So that's just fantastic progress. Providing direct and tailored advice on employment negotiations and training matters. So we have employed GPRA advisors. So they're either they're current registrars or recently fellowed. They've been in your shoes and they know the NTCER very well, and they can guide you in queries or resolving issues that you're facing that relate to your training or employment. And we also have exam preparation and education support. So exam cases books, things that you can use to run through cases and practice and attend webinars to make sure you're all ready for your exams. If you become a member, you also can get some member-only services and discounts on products that can be really helpful for your training. So a bit more about that at the very end. So on to the task at hand, which is employment in general practice. This will be relevant for some of you who are thinking about applying, but things that you need are, clear, concise CV. So keeping that up to date as you gain experience, that's important. In terms of interviews, I personally found the GP interview a lot more casual than the hospital training term interviews. They tended to be more kind of relational and wanting to see what it's going to be like to work together in a small clinic environment, as opposed to highly protocolized and running you through scenarios like in a hospital. So I found I could sort of be myself a lot more, and that was a really nice experience. That being said, preparation is always going to make you feel better in advance, and everyone gets nervous when they're trying to put their best foot forward. So thinking about, one positive experience that you've had with a patient that kind of demonstrates your valuable qualities as a doctor, and one like difficult scenario case where you were pushed or challenged as a doctor. Those are the things that are helpful to prepare in advance. But really, I think it's helpful to think about some pertinent, important questions that you want to ask, like what is important to you in a clinic? That's where you can bring in, some of those really desirable qualities that we talked about before, the six things, demographics, culture, workflow, those sorts of things. Um, and definitely have those on hand. So you don't really want to leave an interview not asking questions. How do GPs and registrars get paid? So you it used to be mostly that employee registrars were employed in a small business setting, which is where the NTCER outlines the minimum terms. So when you leave the hospital, you're no longer necessarily under an EBA, and that's different now with the single employer model, or if you're a salaried doctor at a hospital. But once you get into a small business clinic, you're no longer under the EBA, you're not under an award. So the NTCER outlines really the minimum standards that should be adhered to, and they're the minimum baseline. So your legally binding agreement is your contract. And so it's your opportunity, your responsibility really to cross-check your agreement with the NTCER, make sure these hard-fought minimum terms on your behalf are being reflected in your contract. Single employer model. So this is being trialed by the Australian government until 2028. And this is where your transition from hospital to GP training does not significantly change your employer. So in that situation, you are under the same award as a hospital equivalent, super, parental leave, those things. Sorry, that should say parental leave, not paternity leave. But yeah, those things transfer over. And then after fellowship, you are a sole trader. So you have an ABN. You receive 100% of the billings that you get paid directly by the patient, and then you pay a percentage of those back to the practice called a service fee. So you're paying that for the renting of the clinic, the services provided to you by administrative staff, nursing support, etc. So as an example, I currently pay 35% of my total billings back to my practice as a service fee. And you can work across different practices. You can be like I have casual employment with my local tertiary hospital alongside being a sole trader. You can have research, education roles, etc. Makes tax time really fun when you mix things together. So as I was saying before, it's important to remember the difference between an EBA and an award. An industry award is a legally binding set of standards, and the NTCER is an agreed upon set of standards between GPRA, us, and GPSA, GP Supervisors Australia. So the legally binding document is your contract. And that's where you need to cross-check that, and you can call GPRA advisors to get advice, if you have any questions about that. It covers your working hours. It covers education and supervision, remuneration, leave, resolution of disputes, and you can negotiate conditions beyond the minimum standard. It can be challenging when you first start as a GPT-1 to negotiate above the minimum. But I'm sure many of you, like many people, come into GP training with additional skills that a practice would really value. So it's something that is available to you. So how do you get paid? So the base rate, either base rate or percentage billings. So base rate depends on your training term, and it goes up with the MBS indexation. And you can see there, this is actually taken directly from our website, and there's a really useful and famous calculator on our website that can help you calculate your pay once you fellow. Or you'll go with percentage of billings. So the practice will say, we're calculating it based on your percentage of billings. In addition to that, you should be getting service incentive payments or practice incentive payments. So these incentives are paid directly to the clinic. They're bundled payments. A portion of that should be, can be given to the registrar and should be. Service incentive payments, so those are things like a clinic completing like diabetes annual cycle of care, asthma cycles of care, and you would do a portion of that as a registrar. Practice incentives are things like if you are teaching a medical student, you should get a portion. So the clinic's paid $200 per session to teach a medical student. So if you're doing that, you should be getting part of the payment. And then, of course, on top of that is super. Um, so yes, under the NTCER, you're an employee as a GP registrar. So you are an employee, you're not a sole trader yet. Working hours covers span of hours, additional and ordinary hours, on-call, fatigue management. Education covers your protected and non-protected teaching time, when you need to be released to attend your college webinars and things. Remuneration, so base salary, on-call after hours work, billing cycles, SIPs and PIPs, allowances, expenses, etc. All the important leave, so that parental leave that has been worked so hard to secure on your behalf, that's all in there, thankfully. And then sort of additional items, so things like the need for you to have medical indemnity, termination of your employment, and things like that. Fatigue management also covered. Cultural leave is new and is specified in there, so that's something to have a look at as well. So common things that we get asked about. Whoops. Yeah. So these are really common things that are asked to the GPRA advisors. So those are things like annual leave, 4 weeks a year. You must either take that leave or have it paid out to you. Annual leave in advance can be negotiated and taken before you accrue it. So some practices may try to wait until you accrue your annual leave. You've worked there for a certain amount of time, but that can be negotiated. Payment for your annual leave is paid at the base rate, and it can be rolled over across consecutive contracts if you've not used it. Administration time, so up to 5 hours a week needs to be included in your roster for admin. So your appointments should be taken up by admin. Your practice has to provide you a paid orientation when you start. If you're working overtime hours, that's paid at 150% or taken as time in lieu. After hours on-call pay is covered. They shouldn't take away the cost of supervision or payroll tax or anything like that away from your gross wages. You should have access to your pay slips and all of your billings. And the NTCR is based on the Fair Work Act. So whilst it's not an award per se, they do have legal standing under the relevant state and national legislation. A few tips are when you start, it's of benefit to you to try and negotiate a shorter billings payment cycle. And what that means is the amount of time over which your practice calculates your billings and receipts versus your base rate. So the minimum billing cycle is 4 weeks, but if you can negotiate to fortnightly even. And the reason is if it's the longer time it's averaged over, when you take an educational release, you take an annual leave, sick leave, the calculation becomes less. So your best advantage is to negotiate the shortest billing cycle possible. Fortnightly is ideal. Try to be paid via via your billings rather than your receipts. The reason is that billings includes money that is waiting to come in from Medicare, as opposed to what was paid by the patient on the day. Annual leave will be paid to you at the end of your employment if you don't use it. And it's helpful to align your leave with your billing cycle if you're able to do that. So there are a few different things to get your head around in terms of who can help you where. When it comes to training, placement, it's really your college, the person who's administering your training, and that's your training coordinator. When it comes to small group teaching, mentorship, that sort of thing, your medical educator of your college is the person to talk to. Anything to do with in-practice mentorship and teaching is your direct supervisor, and they may not be the practice owner. So for things to do with employment contract day to day of the practice, even things like your books, your appointment schedule, it's better to go to the practice manager. They oversee the running of the practice as opposed to your supervisor who's not always involved in that kind of thing. Registrar liaison officers are they are people in your training who can give you advice, and they also sit as part of our National Advisory Council. Um, they tend to give you advice about your training, so they are a point between the college and yourself. GPs in training, they sort of do internal college advocacy. They're a faculty of the RACGP, or a faculty of your relevant college. And then finally, the registrar advisors from GPRA are around advocacy, industrial issues, working issues, contract issues, things that aren't going well with the employment side of your practice. That's where GPRA can advise you. And of course, we provide additional exam and peer support and things as well. And GPRA can direct you, of course, to the right place if you're not sure. So final things to consider, just to sum up, is that GP registrars and their employers, yeah, subject to the minimum conditions. And so you should be issued an employment contract which reflects that. Sorry, I don't understand this wording here which says which offers you less, but your employment contract should really be negotiated above the minimum conditions, so better than. Membership with GPRA directly impacts the NTCR negotiations. So we just had the renegotiation this year in April, and there were lots of meetings held with members and councils to directly impact future employment cycles. So join us for free. It's really valuable. Remember, you can negotiate fortnightly to monthly pay cycles. Remember that you need to receive a pay slip and have visibility over your incentives, your Medicare, other top-ups. Check at the end of every week or every day. And from semester 1 of this year, all AGPT registrars should have had access to the salary incentive payment, which is fantastic under this new national consistent payments with the Commonwealth. And all AGPT registrars will have access to study leave and paid parental leave up to 20 weeks.